Hello there. Are you ready to do the pathophysiology practice questions for Unit 2 Part 3? Let's go. Which of the following factors increases the risk of infection in cancer patients? A. Granulocytopenia. B. Paraneoplastic syndrome. C. Cachexia. D. Hypersensitivity reactions. 5 seconds. Correct answer. A. Granulocytopenia. Granulocytopenia means being deficient in certain white blood cells that fight infections. When cancer patients are treated with things like chemotherapy, their body often can't produce enough of these infection-fighting cells. So, they are more likely to get infections because their immune system is weaker. How is coping best defined in the context of stress management? A. Preventing mental strain. B. Managing stressful challenges. C. Adjusting to disease. 5 seconds. Correct answer. B. Managing stressful challenges. Coping is how we deal with stress. It's not about avoiding stress entirely but figuring out ways to manage and handle stressful situations, like problems at work, family issues, or health concerns. Coping can involve different strategies, such as talking to someone, relaxing, or focusing on solutions. Anthony, a middle-aged fisherman, cuts his hand while cleaning a fish. Which blood cell type is likely to be elevated due to the acute inflammatory response? A. Clotting cells, platelets. B. White blood cells, leukocytes. C. Allergy cells, eosinophils. D. Infection-fighting cells, neutrophils. 5 seconds. Correct answer. A. Clotting cells, platelets. When you get a cut, your body's first response is to stop the bleeding. This is where platelets come in. They stick together to form a clot, sealing the wound and preventing further bleeding. So, platelets are the first cells to show up in large numbers after an injury. Later, other white blood cells come in to fight any germs that might have entered the cut and help with healing. But the very first thing your body does is clot the wound with platelets. A patient is diagnosed with systemic lupus erythematosus, SLE. Which type of antibody is most commonly associated with this condition? A. IgE. B. IgG. C. IgA. D. IgM. 5 seconds. Correct answer. B. IgG antibodies are often found in lupus, forming immune complexes that deposit in tissues. Why other options are wrong? A. IgE is primarily associated with allergic reactions. C. IgA is primarily found in mucosal secretions. D. IgM is the first antibody produced during an immune response. Last question for Part 3. According to the general adaptation syndrome, which stage is characterized by the mobilization of resources to cope with a stressor? A. Alarm stage. B. Resistance stage. C. Exhaustion stage. D. Recovery stage. 5 seconds. Correct answer. B. Resistance stage. During the resistance stage, the body attempts to adapt to the stressor by mobilizing resources. Why other options are wrong? A. Alarm stage is the initial response to stress. C. Exhaustion stage occurs when resources are depleted. D. Recovery stage is not part of the gas model. Thank you for reviewing with me. Up next, Unit 2 Part 4.